are going to be introduced later on by Brandon. And yeah, just some few reminders that we normally do in the beginning of our webinar. So our webinars are recorded. So as you enter the Zoom, you have automatically consented on the recording to be done. So just to remind you on that. Also, another reminder is about the language. So our webinars are structured in both English and Nepali, especially for today where we have both English and Nepali speakers. Do post your questions on chat box while the presentations are being carried out, or you can raise your hands after the presentation when we move on to Q&A session. Another reminder is on feedback form, which will be posted by Ritika in the chat box. We request you all to please fill out the feedback form, as it helps us to kind of evaluate our webinars and also to understand what needs to be done to improve it in the future. In terms of structure of the webinar, as you all know, our first 10 minutes, we introduce the speakers along with some housekeeping presentation. We then move on to the actual presentation of the speakers, which goes on to 15 to 20 minutes. After which we move on to question and answer round for about 10 minutes. We then break out into different breakout session and discuss the questions posted by our speakers, and that happens around 15 minutes, after which we end the webinar with a summary and closing remarks for about 5 minutes. As you all know, our monthly webinar series happens every third week of every month, unless there is a gap, which happened in past 2 months, and we've let you all know about that. You receive the invitation via emails, which we send out with the dates and speaker details. The information is also posted in our social media handle in Twitter and Facebook as well. And yeah, and with that, I will hand it over to you, Brandon, for the introduction of the speaker.
Great. Thanks so much, Dristi. Thanks for welcoming everybody. And I'm also delighted to be able to introduce this session with 2 fantastic speakers. And I really encourage you all to post questions throughout, any reflections, observations. But this feedback is really important for us, as this will contribute to improving our understandings and interpretations of the output. So the more feedback, the more suggestions, the more reflections, the more you can strengthen this work. First, I want to introduce Christina Wan. So she is a global health DRPH candidate at George Washington University and a researcher with the Center for Global Mental Health Equity. Her research includes an exploration of the association between gender attitudes, polyvictimization, and adolescent mental health, as well as examining social connectedness among women in the postpartum period in Nepal. Previously, she conducted research at the Demographic and Health Surveys Program and the International Center for Research on Women. She grew up in New York in the US and attended the University of Michigan. She received a master's in science in reproductive and sexual health research from the London School of Hygiene and Tropical Medicine. In addition, we have Benita Acharya. Do we have one slide forward? Go. Benita Acharya is currently working as a research officer in Transcultural Psychosocial Organization TBO Nepal in Gandaki Province. She completed her master's in population, gender, and development in 2023 and her bachelor's in public health in 2019 from Pokhara University. She first started working in the remote area of Karnali province, from where she found herself more interested in the ground issues in society and realized the need for social science and cultural psychiatry, particularly in low and middle income countries. As an early career researcher herself, she's now leading the capacity building objective of the Reshape project, which focuses on building the capacity of early and mid-career mental health researchers in Nepal, and her work focused on reducing gender gaps, involvement of people with lived experience of mental health conditions, and inclusivity in health research beyond cultural limitations. Well, we're delighted to have you both. So with that, let me turn back over to you.
Thank you, Brandon, for your introduction. So let me share my slide first. Okay. Namaste सबैजनालाई. Thank you so much for joining us today. I am Vinita Acharya. So आज चाहिँ हाम्रो वेबिनारको टाइटल अनुसार चाहिँ we'll be talking about the findings from a qualitative study among researchers in Nepal, which focusing on the gender equity lens and global mental health research. So to make it more simple, हाम्रो यो topic what matters most आउनुको context rational भनेको चाहिँ I'll be discussing in these three points. The first one is जस्तो हाम्रो जेन्डर ग्यापको कुराहरू प्रोफेसनलिजममा अथवा धेरै सेक्टरहरूमा जेन्डर ग्यापको कुराहरू धेरै नै आइराख्दा चाहिँ जस्तो हाम्रो अझै पनि जस्तो रिसर्च टिममा नै रिसर्च वर्क फोर्समा नै अलिकति जेन्डर डिस्प्यारिटिज भइरहेको कुराहरू चाहिँ अलिकति अननोटिस्ड ओभरलुक भइरहेको छ भन्ने कुराहरू चाहिँ त्यो वुमेन रिसर्चर्सहरू जुन ग्लोबल मेन्टल हेल्थ रिसर्चमा काम गरिराख्नु भएको छ उहाँहरूको थ्रुबाट त्यो कुराहरू धेरै नै आइरहेको थियो। अनि त्यही हेर्दा चाहिँ जस्तो यसले चाहिँ के देखाउँछ भने जस्तो ग्लोबली देयर इज अ ग्याप इन ग्लोबल मेन्टल हेल्थ रिसर्च। सो अल्सो बिकज अफ द्याट देयर आर इनिसिएटिभ्स टु एड्रेस इट एज वेल। सो त्यसमा चाहिँ एउटा भनेको डिकोलोनाइजेसन इन मेन्टल हेल्थ रिसर्च भनेर जुन अहिले आइरहेको छ ग्लोबल्ली, जुन चाहिँ ग्लोबल नर्थ र ग्लोबल साउथको जुन ग्याप रिड्युस गर्नको लागि त्यो इनिसिएटिभ्सहरू हुँदै राख्दा चाहिँ एट द सेम टाइम ग्लोबल साउथ नेपाल जस्तो कन्ट्रीहरूमा चाहिँ अझै पनि जस्तो त्यसरी इम्प्लिमेन्टेसन हुँदै गर्दा चाहिँ अरू जुन लोकल पावर डाइनामिक्सको कुराहरू जस्तो जेन्डर कास्ट एथनिसिटीको कुराहरू चाहिँ त्यो चाहिँ ब्यालेन्स छ कि छैन भन्ने कुराहरूको चाहिँ अलिकति कन्सिडर नभएको कुराहरू चाहिँ देखिन्छ। सो द्याट विच सोज द्याट देयर इज अ निड अफ इन्क्लुसिभ क्यापेसिटी बिल्डिङ एफोर्ट्स इन मेन्टल हेल्थ रिसर्च। सो अर्को भनेको हामीले जुन यो ग्लोबली दुईटा कुराहरू फोकस गर्दै जाँदा चाहिँ बट नेपालमा चाहिँ के कुराले गर्दा चाहिँ फिमेललाई करियर प्रोग्रेसनमा बेरियर्स भइरहेको छ भन्ने कुराहरू बुझ्दै जाँदा चाहिँ जस्तो रिसर्च फिल्डमा कम्युनिकेसन्सको कुराहरू अनि मल्टिपल रोल्स अफ वुमेन इन लो एन्ड मिडल इन्कम कन्ट्री, सो नेपालमा पनि अनि अरू जेन्डर पोजिसन्सहरू रिप्रेजेन्टेसनको कुराहरूले गर्दा चाहिँ करियर प्रोग्रेसनमा चाहिँ बेरियर्स हुन्छ भन्ने कुराहरू चाहिँ हामीले फिमेल रिसर्चर्सहरूको थ्रुबाट पायौँ। सो अल्सो कनेक्टिङ विथ द कन्टेक्स्ट हाम्रो अरू च्यालेन्जेसहरू चाहिँ एकदमै धेरै देखेको भनेको जस्तो रिसर्चर्सहरू फिमेल रिसर्चर्सहरूलाई ट्रेन गर्ने कुराहरू चाहिँ देखि नै रहेको हुन्छ। जस्तो बट के कुराले ट्रेन गर्ने, वाट म्याटर्स टु देम, वाट दे रियल्ली निड भन्ने कुराहरू चाहिँ अलिकति त्यो फोकस नगरिएको हो कि भन्ने खालको कुराले गर्दा चाहिँ च्यालेन्जेसहरू देखिन्छ करियर ग्रोथको लागि भन्ने कुराहरू। अनि सेकेन्ड थिङ भनेको जस्तो मेन्टरसिपको कुराहरू, मेन्टर रिलेसनसिपको कुराहरू र पियर सपोर्ट को लर्निङ अप्रोचेसको कुराहरू चाहिँ अझै पनि हाम्रो नर्मलाइज हुन अनि त्यसपछि कसरी त्यसलाई चाहिँ अलि इन्क्लुसिभ बनाउन सकिन्छ भन्ने कुराहरू चाहिँ अलिकति च्यालेन्जिङ नै छ भन्ने कुराहरू छ। अनि जस्तो हामीले लो इन्स्टिट्युसनल क्यापेसिटीको कुरा गर्दाखेरि चाहिँ कुनै इन्स्टिट्युसनमा अथवा रिसर्च टिमको कुरा गर्दा चाहिँ कसरी त्यसलाई चाहिँ उहाँहरूले कसरी इन्क्लुसिभ बनाउनु भएको छ अथवा एकाडेमिक लेभलमा हेर्नु पर्दा चाहिँ त्यो मेन्टरसिप सुपरभिजनको कुराहरू चाहिँ हाउ दे आर फोकसिङ करिकुलमको कुराहरू प्रायोरिटीको कुराहरूमा जेन्डर एथनिसिटी कास्टको कुराहरूलाई चाहिँ कसरी हेर्नु भएको छ भन्ने कुराहरू चाहिँ त्यो फोकसमै नगएको कारणले गर्दा च्यालेन्जेस छ भन्ने कुराहरू धेरै नै जस्तो हामीले लिट्रेचर रिभ्यू गर्दा अनि हामीले पनि आफैले फेस गरेको कुराहरू हो यो भनेको च्यालेन्जेसको कुराहरू। सो एट द सेम टाइम हामीले च्यालेन्जेसको कुरा गर्दै गर्दा अपर्च्युनिटिजहरू पनि लो एन्ड मिडल इन्कम कन्ट्रिज, सो नेपाल जस्तो कन्ट्रीहरूमा पनि जस्तो धेरै इनिसिएटिभ्सहरूको थ्रुबाट जस्तो अघि मैले भने डिकोलोनाइजिङको कन्सेप्ट र क्यापेसिटी बिल्डिङ प्लेटफर्मको कुरा गर्दै जाँदा चाहिँ सो एट द सेम टाइम द वर्ल्ड इज मुभिङ टुवर्ड्स इट। त्यस्तै खालको रिसर्चहरू जुन अलिकति रेलेभेन्ट खालको रिसर्चहरू छ त्यो चाहिँ हाम्रो अलिकति धेरै डिमान्ड भएको कारणले गर्दा चाहिँ हामी रिसर्चर्सहरू फिमेल रिसर्चरहरूले त्यसमा फोकस गर्दा चाहिँ अलिकति अपर्च्युनिटी क्रिएट हुन्छ भन्ने कुराहरू छ। अनि त्यही हामीले जुन रिभ्यू गर्दै जाँदा के चाहिँ इनिसिएटिभ्स भएको छ अथवा के गर्न सकिन्छ भन्ने कुराहरू फोकस गर्ने जाँदा फर इक्जाम्पल हाम्रो सेयर इन साउथ एसिया अफिम इन साउथ अफ्रिका भन्ने छ। यसमा चाहिँ यो भनेको नि एउटा डिकोलोनाइज क्यापेसिटी बिल्डिङको एफोर्ट्सहरू छ जसले चाहिँ जस्तो मेन्टरसिपको कुराहरू अनि कोलाबोरेसन फोस्टर गर्ने कुराहरूलाई चाहिँ फोकस गरिरहेको छ। सो यो भनेको चाहिँ सबै एलएमआइसी र ग्लोबली के भइरहेको छ भन्ने इनिसिएटिभ्स हेर्दै गर्दा चाहिँ हामीले पनि हाम्रो नेपालमा नेपाल मेन्टल हेल्थ रिसर्च नेटवर्क भन्ने हाम्रो रिसर्च नेटवर्कहरू चाहिँ एज अ पार्ट अफ क्यापेसिटी बिल्डिङ अब्जेक्टिभ अफ रिसेप प्रोजेक्ट भनेर हामीले चाहिँ त्यो फर्मेसन गरेका थियौँ। सो हजुरहरू पनि त्यसमा हुनुहुन्छ होला। सो हाम्रो वेबिनारमा पनि त्यसमा चाहिँ वी ह्याभ 245 अर्ली एन्ड मिड करियर रिसर्चर्स जसमा हु आर अल्सो इन्ट्रेस्टेड इन मेन्टल एन्ड बिहेभियरल हेल्थ रिसर्च। अनि हामीले चाहिँ विथ द नेटवर्क मेम्बर्स उहाँहरूको कुराहरूलाई बुझेर इभिडेन्सहरूलाई बुझेर चाहिँ कसरी त्यो क्यापेसिटी बिल्डिङ गर्न सकिन्छ, कसरी फिमेल रिसर्चर्सहरूलाई अलिकति प्रोमोट गर्न सकिन्छ भन्ने कुराहरूलाई फोकस गर्दै चाहिँ हामीले जस्तो नेटवर्किङ इभेन्ट्सहरू जस्तो फर्मल इन्फर्मलहरू हुन्छ, जहाँ चाहिँ उहाँहरूले चाहिँ इन्फर्मल वेमा चाहिँ कसैलाई कनेक्ट गर्नलाई इजी हुन्छ भन्ने कुराहरू एउटा इभेन्ट्स त्यो पनि एउटा इनिसिएटिभ्स हो। जस्तो मैले यहाँ पनि देखिरहेको छु, हजुर पनि त्यसमा आउनु भएको थियो होला, किन यहाँ पार्टिसिपेन्ट हुने हाम्रो नेटवर्क मेम्बर्सहरू पनि हुनुहुन्छ। अनि अर्को भनेको जुन मन्थली वेबिनार्स जुन अघिदेखि हामीले वेबिनार सिरिज भनेर कुरा गर्दैछौँ, त्यो अहिले भएको पनि जुन 24th वेबिनार सिरिजमा आएको छ, यो पनि एउटा हाम्रो यही रिसर्च नेटवर्कको इनिसिएटिभ्स हो। फ्रम वेयर जस्तो हामीले अघि नै भएको ग्यापदेखि ग्लोबल कन्टेक्स्टमा ग्याप भएको कुराहरू गर्दै आउँदा चाहिँ यसलाई रिड्युस गर्नको लागि चाहिँ एउटा सानो इनिसिएटिभ्स हो। फ्रम द्याट वी कनेक्ट टु सम वान जेन्डर एथनिसिटीको कतिको इन्क्लुसिभिटी छ यसमा भन्ने कुराहरू हुन्छ। अनि अर्को भनेको चाहिँ हामीले इयरली ग्लोबल मेन्टल हेल्थ सर्ट कोर्सेसहरू अर्गनाइज गर्दै आइरहेका छौँ। जस्तो त्यसमा चाहिँ टुल्सहरूको बारेमा मेथोडोलोजीहरूको कुराहरू गर्दै त्यो भयो। अनि हामीले चाहिँ जस्तो फिमेल रिसर्चरहरूलाई चाहिँ एज अर्ली करियर रिसर्चर्स करियर ग्रोथको कुरामा चाहिँ जुन फन्डिङको कुराहरू अनि प्रायोरिटीको कुराहरू कसरी उहाँलाई अलिकति कन्फिडेन्स डेभलप गर्ने भनेर हाम्रो ब्रान्डको कुराहरू र मेन्टरसिप पनि हामीले दिएर चाहिँ त्यो अहिले रिसर्च वर्क चाहिँ अहिले कन्टिन्यू भइरहेको छ। एन्ड एट द सेम टाइम हामीले जस्तो यो एसएनए चाहिँ सोसियल नेटवर्क एनालाइसिस जुन हजुरहरूलाई एकदमै धेरै इमेल आइरहेको छ, अनि मैले कहिले कहिले एकदम गाली पनि खान्छु होला त्यो इमेल देखेर। सो हाम्रो यो सोसियल नेटवर्क एनालाइसिसको सर्वे भनेको चाहिँ हामीले जस्तो यो नेटवर्क मेम्बर्सहरू बनायौँ एज अ इनिसिएटिभ्स। अनि त्यसपछि यसमा चाहिँ हामीले जस्तो नलेज मेन्टरसिपको कतिजनासँग कनेक्ट हुनुहुन्छ, कोलाबोरेसन कतिको भइरहेछ भनेर चाहिँ ओभर द इयर्स यसलाई एसेस गर्नको लागि चाहिँ त्यो सर्वेहरू गर्दै आइरहेका छौँ। सो हजुरहरूले त्यो नेटवर्क मेम्बर्स यहाँ जो पनि आउनु भएको छ, त्यो सर्वे भनेको चाहिँ यतिको इम्पोर्टेन्ट छ है भनेर त्यो सर्वे चाहिँ भइदिनु होला, त्यसको लागि रिक्वेस्ट गर्छु मैले यहीँबाट। सो यस्तै इभेन्ट्सहरू गर्दै जाँदा चाहिँ हामीले के देख्यौँ भने जस्तो अझै क्यापेसिटी बिल्डिङ इनिसिएटिभ्सहरूमा चाहिँ जस्तो अलिकति हाम्रो नेपालमा पनि इन्टरपर्सनल डाइमेन्सनमा अलिकति फोकस गएर स्टार्ट गऱ्यो भने चाहिँ अलिकति बेटर हुन्छ कि अझै यसलाई अलिकति फ्रुटफुल हुन्छ कि भन्ने कन्सेप्ट चाहिँ जाँदा चाहिँ यो सबै सुरुमा ग्लोबल कन्टेक्स्ट च्यालेन्जेस र अपर्च्युनिटिज इनिसिएटिभ्स र हामीले गरेको इनिसिएटिभ्सलाई हेर्दा चाहिँ हामीले त्यही नै इनिसिएटिभ्सबाट जुन हाम्रो 245 नेटवर्क मेम्बर्स हुनुहुन्छ उहाँहरूबाट नै पार्टिसिपेन्ट्स 28 पार्टिसिपेन्ट्स लिएर चाहिँ हामीले चाहिँ यो अहिलेको यो करेन्ट स्टडी जुन हामीले प्रेजेन्ट गरिरहेका छौँ त्यसमा फोकस रहेर हामीले स्टडी कन्डक्ट गरेको थियौँ। वी कन्डक्टेड की इन्फर्मेन्ट इन्टरभ्युज अनि जसमा चाहिँ अब्जेक्टिभ चाहिँ टु identify the challenges and barriers at the individual, interpersonal, community and policy level को कुराहरू भयो भने जसमा रिसर्च क्वेसन्स चाहिँ what matters most among researchers conducting mental health research in Nepal भन्ने थियो। सो आज चाहिँ यसमा चाहिँ हाम्रो जेन्डर इक्विटी लेन्सको पर्सपेक्टिभमा चाहिँ हामीले फोकस गरिरहेका छौँ। सो द इन्टरभ्यू वाज 90 मिनट लङ अनि हामीले यो इन्टरभ्यूहरू कन्डक्ट गरेको चाहिँ कोभिड पछाडिको कोभिड भइरहेको टाइममा जस्तो विन्टर 2021 देखि स्प्रिङ 2022 सम्म कन्डक्ट गरेका थियौँ। सो यो रिसर्चको बारेमा यति नै छ। सो मैले यहाँसम्म रोकेर मेरो यहाँभन्दा पछाडिको प्रेजेन्टेसन चाहिँ मेरो कोलिग्सले कन्टिन्यू गर्नुहुन्छ। सो थ्याङ्क यू सो मच एन्ड कृष्ण यु क्यान कन्टिन्यू फ्रम हियर।
Thank you, Benita, and thank you everyone for taking the time out of your day to be together to talk about these findings. And it's really such a unique opportunity to be able to do this with this network because we interviewed a lot of you from those who completed the SNA baseline. So this is a really awesome opportunity in research of how do you discuss the findings that we've learned so that we can make sense of it together. So in diving in, building off of what Benita has shared, we were able to interview 28 participants, and most of them are female, and most of them are Nepali early career researchers. And we were also able to purposefully sample across the different ethnicities. So we wanted to get a different sample accounting for the diversity of the people who are conducting behavioral and mental health research in Nepal. Next slide, please. Oh, thank you. In terms of what we focused on, so we were looking at what matters most to researchers at these various levels. So individual, interpersonal, policy levels. And we were focused for this study on what matters most to conduct global mental health research. And the way that we were defining it is thinking about the personal and professional development goals of people who conduct this research. How do they live this moral life, doing what they care about? Also, we were interested in social determinants like gender, caste, ethnicity, age, education, and domains related to collaboration, mentorship, networking opportunities, and a host of other things. But for this webinar, we'll focus on these three domains. Next slide. Oops. So what we came up with, what we saw were three themes that we wanted to share with you in the form of these really long quotes, but hopefully we can distill them a little bit in this short time that we have together. So what matters most, we asked participants, what do they care about when they're conducting this type of research? What drives them? And what are some of the priorities that we need to be considering while they're doing this type of mental health and behavioral health research in Nepal? One of the themes that came up was this importance of work-life balance, and also the importance of learning skills that pertain to both professional and personal interests when it comes to mental health. So it was very synergistic in that way. But I'm just pointing out here a quote that I wanted to flag for you of a researcher who basically said, family is the most important thing for us, chuckles, which I love that part. So career will obviously go along with our hard work, but without family, just doing work only is not much of our importance. So we decided, let's move to Kathmandu, where my house is, and where we used to live in Chitwan. My wife and I were the only ones who were living there. And we used to call our parents to take care of our little one. It was quite, not good because my parents are getting old, and getting them to travel all the way from Kathmandu to Chitwan is not good because the root condition is not so good. We decided, let's start our career from where we live and let's take family along with us. Like that, we moved to Kathmandu, and now the family are very happy because in Nepal, we live with our parents, as far as we can. Now the parents are happier and we're doing well with our careers. Something in terms of gender, we didn't find any gender difference when it came to this theme. Both, for example, male and female researchers at various career levels, and from those who are Nepali and non-Nepali, talked about the importance of finding a balance of honing their interest in research, and then also finding time for their hobbies and their families and caregiving. Next slide, please. Another theme that we wanted to share with you that came up during this research was this importance for psychological safety in the workplace. So having this culture for asking questions. There were some barriers and facilitators related to simply asking questions about, let's say, randomization or asking for help. And so I wanted to share these two quotes with you to kind of capture some of the findings. So one person was sharing, one researcher said, it's very disproportionate, like the amount of work the mentee has to do versus the mentor, right? Like your question was even framed like it wasn't like, tell me about a mentor that reached out to you to help you. It was like, who did you reach out to for help? I think there's a lot of imbalance there, and people have to know how to ask for help, but they have to know what to ask. And so one of the themes that we wanted to share was this mentor-mentee relationship that feels imbalanced, and then the importance of knowing what types of questions to ask and how to ask, and that the call for help in strategies for that. Similarly, along the same lines, another researcher said, I'm not a good conversation starter, especially with a stranger. I think I don't have that skill to start a conversation. Even if I'm given the opportunity, I don't think I would make the best out of it. And this researcher was talking about the importance of taking the conversation forward. So within the same lines of knowing what types of questions to ask, how to ask the questions, how do you drive the conversations, let's say in a mentorship, mentee relationship? And now also, how do you shift that balance, or let's say that responsibility from the mentee to the mentor, so that it feels a little bit safer and more open. Next slide, please. Thank you. And the last thing we wanted to share that's also related to this culture for asking questions is there's a lot of emphasis on theoretical knowledge, with less emphasis and less maybe teaching around applied and I guess real world experience with research. And participants really wanted that kind of I guess those kinds of strategies or approaches to be shared within the research culture. In terms of gender was definitely something that was a barrier in Nepal in the workplace. And this one participant said, no matter how open the society is, how understanding the people are, still women have to face some hindrances or problems in comparison to men. And she added, women used to feel the mental workload. Even if they are qualified, they have to prove themselves in so many cases in relation to male researchers. So obviously this is a very complicated situation, but these are some of the themes that we wanted to present to you through the gender equity lens. Next slide, Benita. And I know we're running out of time, but I just wanted to share this snapshot of what we just discussed. So the three different themes that we wanted to share with you, which is what matters most, a culture of asking questions, and research culture. Some of the summary findings, this idea of cultivating work-life balance, finding skills and mental health topics that apply to both personal and professional spaces, and having more concrete ways for researchers to ask for help in a safe and open and conducive environment for doing quality research. And then, yeah, more applied. We want more applied practical guidance. Next slide, please. So in conclusion, we wanted to share that it would be important to find a way to have active opportunities to reflect on our values and our goals. We are researchers. We are in this work because we really care. There's no question about that people want to blend their personal with their professional. And I also think that something that we were talking about is the importance of navigating and discussing work-life balance through this structured mentorship and collaboration that feels safe, where you're encouraged to question and you're encouraged to learn from one another in a more safe space. So what we were thinking was we could strategically implement these programs and policies that align with these core priorities for researchers. And this will not only elevate the quality of the mental health research, acknowledging these different social determinants, the diversity within our research workforce, but by doing so, this holds the potential to have conversations about gender attitudes and norms in the workplace and what matters most to us, which is also beyond that as well. Thank you so much. And thank you for the opportunity to share.
All right. Thank you so much, Bintaji and Christina, for your wonderful presentation. I think this is a very interesting topic for all of us because it affects every single person here in this webinar. And I'm sure you've had some time to reflect on your personal life as well as a researcher based on the findings here. And with that, I think we now have the floor open for any questions. So if I don't see any questions on the chat, but if you have any questions to ask, please feel free to raise your hand and unmute yourself. And if Ritika, if you see any hands up, because I don't, please let me know. But just to get the conversation going, if I can, Christine and Vinita, if I could ask some questions from my side as well, because this is really, really interesting topic to me personally as well. So you talk about like work-life balance as what matters most, right? As like a key finding. And I'm wondering like how, because I feel like that's true also for any other field. It doesn't necessarily have to be research or in particular mental health, behavioral health research. That is true for especially for women working in various fields. So did you get to like any nuances around like how like tease out anything regarding what in particular affects that work-life balance as a mental and behavioral health research?
Thank you, Dristy, for that question. That's such a good question. And I think maybe it is not unique to the mental and behavioral health research field. Within this context and within the sample that we were able to interview, it kept popping up. Also, I think because there's this clash of doing research in a, let's say, what we learned from the findings, a culture that doesn't really treat research seriously. So it's still developing. It's kind of, my understanding from the research is it's kind of still sidelined, or it's not in the hierarchy of professions. It's still developing. Also, there were talks about challenges at the funding and the institutional levels, and how those barriers affect or worsen someone's work-life balance. Because the incentives aren't there to match the drive that people have. The funding isn't there to support, you know, someone's writing of manuscripts or yeah, so the research culture is definitely connected to this also need for work-life balance and for family balance and just yeah, having a life that doesn't feel like that's not completely like you prioritize it, but then where's the funding and where's like that culture that can like hold it and support it, if that makes sense.
Thank you, Christina. And I think we have a question here from A536, some random number. I'm not going to say everything out loud, but the comment and question and a compliment. So in the context of Nepal, most of the practitioners on mental health are women, and in your research, you have interviewed only 33% of males. Can you please explore the challenges of male researchers or male from minorities too? And as a compliment, your research findings are insightful, is what the person says. So maybe I'll pass this on to first Binita Bintaji. So हाम्रो यो उसमा चाहिँ 33% males छन्, but तपाईँले फाइन्डिङ्सहरू एनालिसिसहरू गर्दाखेरि त्यस्तो लाइक मेल्सहरूको पर्टिकुलर स्पेसली मेल्स फ्रम माइनोरिटिजहरूको स्पेसिफिकली केही भेट्नु भएको पाउनु भएको सेयर गर्ने त्यस्तो केही छ?
थ्याङ्क यू सो मच एकदम राम्रो क्वेसन थियो यो सो हामीले रिसर्च गर्दा चाहिँ जुन हामीले अब बेरियर्स एन्ड फेसिलिटेटर्स भनेर हाम्रो अब्जेक्टिभ्समा रहेर हामीले रिसर्च गरेका थियौँ सो एट द सेम टाइम फिमेलमा मात्र नभएर मेलमा पनि त्यो दुवैजनाको इन्टरभ्युजहरू थियो जसमा चाहिँ जुन यो च्यालेन्जेस भन्ने कुराहरू छ जुन अब माइनोरिटिज ग्रुप मेल होस् या फिमेल माइनोरिटिज ग्रुप इट डजन्ट म्याटर टु जेन्डर हामीले चाहिँ जुन अब त्यो डिकोलोनाइजेसन क्यापासिटी बिल्डिङ प्लेटफर्मको कुरा गर्दैछौँ त्यसमा जेन्डर र एथनिसिटी एथनिक माइनोरिटिजको कुराहरू पनि थियो जसमा च्यालेन्जेसको हामीलाई आएको भनेको त्यही मेन्टरसिपको कुराहरू र हामीले चाहिँ जुन जो ग्याप कम गर्न चाहिँ जुन हाम्रो इम्प्लिमेन्टेसनमा प्रोजेक्टहरू नेपालमा आउँछ त्यसमा चाहिँ कसले लिड गरिरहेको छ जस्तो हाम्रो कम्युनिटीमा लिडिङ एथनिसिटी कुन छ र त्यहाँबाट भइरहेको हायर कास्टकै हुनुहुन्छ भने पनि त्यही लिडिङ भइरहेर त्यसरी नै प्रोजेक्ट जाँदै जाने तर माइनोरिटिज र फिमेललाई चाहिँ त्यो चाहिँ ब्यालेन्स नभइकन चाहिँ त्यहाँसम्म पुगेकै छैन भन्ने कुरा च्यालेन्जेस नै त्यही नै छ भनेर जस्तो यो पर्सपेक्टिभ डिकोलोनाइजेसनको पर्सपेक्टिभ चाहिँ हामीले राखेर एथनिक माइनोरिटिज र जेन्डरको कुराहरू इन्क्लुड गरेका छौँ सो च्यालेन्जेस भनेको एउटा सेम नै टाइम हो इट्स जस्ट लाइक वी आर फोकसिङ द ओन्ली जेन्डर इक्विटी लेन्स हियर डु यु हेभ एनिथिङ क्रिस्टिना you are on mute.
Thanks, Benita. One thing that comes to mind for your question about can you explore any challenges of male researchers or male from minorities? Something that we observed is this difficulty that both female participants and male participants talked about during the interviews was this difficulty in discussing emotions and communicating. So I think, you know, as we've seen from the previous research in Nepal, one of the barriers is communication difficulties, and that also pertains to male researchers. One male researcher that we actually interviewed talked about he feels as though it's harder for him to share his emotions. It's a barrier to not be able to communicate and feel that vulnerability to safely ask questions. And so this definitely pertains to male researchers as well.
All right, I was getting worried because there weren't many questions coming in, but we have another question from Dr. Dhirendra, who asked, how satisfied were researchers with career in global mental health in relation to work-life balance? What suggestions or advice for them, for the new researchers who want to work in global mental health in Nepal? Thank you. Any of you can unmute and answer this question. I'll leave it up to you.
You want to start?
यसमा चाहिँ मेरो एउटा दुईटा पोइन्ट्सहरु पनि छ सो आफ्टर दैट यु क्यान कन्टिन्यू क्रिस्टिना सो थ्यांक यू डाक्टर धीरेन्द्र यो क्वेशनको लागि चाहिँ जस्तो यो ग्लोबल मेन्टल हेल्थ रिसर्चर्समा हामीले इन्टरभ्यु गरेको जुन पनि फिमेल रिसर्चरहरु हुनुहुन्छ उहाँहरुको पर्सपेक्टिभमा चाहिँ रिसर्चको वर्क लाइफ ब्यालेन्सको कुराहरुमा चाहिँ अझै पनि जस्तो ब्यालेन्सको कुराहरुमा जस्तो लिडरशिप पोजिसन्सको कुराहरुमा चाहिँ जस्तो फिमेल कम भएको र उहाँहरुलाई पनि लिडरशिप पोजिसनमा चाहिँ त्यही वर्क लाइफ जस्तो फ्यामिली पनि छ काम पनि गर्नुपर्छ रिसर्च पनि छ भनेको कारणले गर्दाखेरि चाहिँ ग्लोबल मेन्टल हेल्थ रिसर्चमा जुन टाइममा चाहिँ मेलको प्रोग्रेसन हुन्छ जुन टाइममा अलिकति बेनिफिटेड ग्रुप्सको प्रोग्रेसन हुन्छ त्यसमा चाहिँ हुँदैन भन्ने खालको अलिकति फिडब्याकहरु आइराको थियो जसमा चाहिँ उहाँहरुको सजेसन्स भनेको चाहिँ जस्तो हाम्रो एकाडेमिक लेभलबाट स्टार्ट हुन्छ जस्तो यो वर्क लाइफ ब्यालेन्सको कुराहरु एकाडेमिक लेभलमै रिसर्चलाई ग्लोबल मेन्टल हेल्थ रिसर्चलाई प्रायोरिटी दिएर त्यहीबाट स्किल डेभलपमेन्टको कुराहरुलाई फोकस गरेर कसरी त्यसलाई नेभिगेट गर्ने र कसरी वर्क सँगसँगै काम सँगसँगै त्यो रिसर्चको पर्सपेक्टिभलाई चाहिँ त्यसलाई अलिकति रिसर्च कल्चरको डेभलप गरेर रिसर्च पनि इम्पोर्टेन्ट छ र त्यसमा चाहिँ फ्लेक्सिबल वर्किङ आवर्स भयो भने अथवा कुनै पनि अब फिमेल छ रिसर्चर्स ल उ कुनै प्रोजेक्टमा काम गरिरहेको छ भने इफ सी हेज फ्यामिली अर इफ सी हेज अ चाइल्ड अर इफ सी इज प्रेग्नेन्ट अर समथिङ लाइक द्याट त्यो भयो भने चाहिँ उहाँहरूलाई चाहिँ जुन टाइममा उहाँहरूले काम गर्दाखेरि उहाँहरूलाई अलिकति फ्लेक्सिबल हुन्छ जुन टाइममा काम गर्दा चाहिँ जस्तो डेडलाइन सहित काम गर्दा अथवा अरू टाइममा काम गर्दाखेरि उहाँहरूलाई अलिकति कम्फर्टेबल फिल हुन्छ त्यस्तो खालको इन्भाइरोमेन्ट यदि जेन्डर इन्क्लुसिभिटी र जस्तो कुनै प्रोजेक्ट अर्गनाइजेसनल लेभलबाट र गभर्नमेन्ट लेभलबाट त्यो कुरालाई अलिकति फोकस गर्यो भने चाहिँ अलिकति वर्क लाइफ ब्यालेन्सकोमा त्यो अलिकति राम्रो हुन्छ ग्लोबल मेन्टल हेल्थ रिसर्चमा भन्ने कुराहरू छ सो यसको एक्जाम्पलमा चाहिँ जस्तो हामी पनि एज अ अर्ली करियर रिसर्चर पनि वर्क लाइफ ब्यालेन्स गर्न हाम्रो पर्सपेक्टिभ पनि उहाँहरूसँगै नै मिल्छ जस्तो धेरै लेभलबाट इन्स्टिट्युसनल लेभलबाट नै त्यो वर्क लाइफ ब्यालेन्स इट्स सेम फर एभ्रीवन इभन इट्स मेन अर वुमेन सो यो कुरामा फोकस भयो भने चाहिँ पोलिसी लेभलबाटै अथवा अर्गनाइजेसनल स्ट्रक्चरबाटै भयो भने चाहिँ अलिकति सजिलो हुन्छ भन्ने कुराहरू छ डु यु हेभ एनिथिङ क्रिस्टिना आई वाज सेयिङ अबाउट द इन्स्टिट्युसनल एन्ड गभर्नमेन्ट सपोर्ट अन दिस
Yeah, and Christina, can I ask you to keep your comments short because we need to move on to our breakout session soon.
I'm happy to end that here. Yeah, that sounds great.
Okay, we have another question, and I'm glad because it shows that the topic is very interesting. Considering the time, I'm not going to ask this question, but maybe if you filled out our form, then you can receive your comments from our speakers via email, if that's okay with you, Devashisi. Ritika, are we good to go to the breakout session?
Yes. Thank you,
Awesome.
everybody. Just to let you know that we have 3 breakout rooms, and all the breakout rooms close automatically after 12 minutes. You will have a notification of 30 seconds before the breakout room is going to close. So, yeah, enjoy the breakout rooms. I'm opening the rooms now.
Points from our group. So we discussed on the question what could be done at the institutional level to reduce gender gap in mental health researchers. So not just gender मात्रै हैन अलिकति more early career researchersहरूको barriersहरूको पनि डिस्कस गरिरहेको थियौँ. So major pointsहरूमा चाहिँ equal opportunities in policies को कुराहरू आएको थियो. So policyहरू हुनुपर्छ to reduce the gap भन्ने कुराहरू र एकदमै सबैजनाले अग्री गर्नुभएको एकदमै धेरै आएको कुराहरूमा चाहिँ मेन्टरसिप प्रोग्राम्स अपर्च्युनिटिजहरू चाहिँ इन्स्टिट्युसनले गर्नुपर्छ विच इज नट युजुअली सिन इन नेपालको केसमा भन्ने कुराहरू र kind of like a validation to your findings, Christina and Vinita, that people don't know where to go, what to ask, sort of thing. So that came up quite a lot in our group discussion as well. So guidance around just where to go, what to ask, what to do, sort of those sort of things. And so opportunities those should be advertised as well भन्ने कुराहरू पनि आएको थियो. अर्को चाहिँ researchersहरूको mapping expertise in which area where are they working भन्ने त्यो mapping पनि नेपालमा छैन. So that's another exercise that an institution can do भन्ने कुराहरू आएको थियो. र newcomers early careersहरूलाई welcoming environment, again mentorship environmentहरू हुनुपर्छ भन्ने कुराहरू र institutional levelबाट चाहिँ internships because early career especially in undergrad level or even graduate levelहरूमा पनि research कस्तो हुनुपर्छ कुन अर्गनाइजेसनले गर्छ भन्ने कुराहरू पनि थाहा नहुने र त्यस्तो इन्स्टिट्युसन्सहरूमा चाहिँ टिपिओ जस्तो संस्थाहरूले चाहिँ इन्टर्न्सहरू त्यो एकाडेमिक इन्स्टिट्युसन्सहरूबाट लिँदा राम्रो हुन्छ भन्ने डिस्कसन्सहरू चाहिँ भएको थियो हाम्रोबाट. And with that, I'll pass it on to Vintaji to summarize your group discussion.
ओके हाम्रोमा चाहिँ डिस्कसन्स जस्तो यो केले चाहिँ रिड्युस गर्न सकिन्छ भन्ने कुरामा मोस्टली चाहिँ जस्तो हाम्रो पोलिसी डेभलपमेन्टको र गभर्मेन्ट लेभलकै ले प्रायोरिटी दिने नै कुरा भयो. जस्तो इन्स्टिट्युसनल लेभलमा अथवा एकाडेमिक लेभलमा चाहिँ रिसर्च अथवा सबै प्रोफेसनहरूमा चाहिँ जेन्डरको ब्यालेन्स र रिप्रेजेन्टेसन्स एउटै हुने भन्ने खालको पोलिसी अथवा गभर्मेन्ट लेभलबाट त्यस्तो खालको इनिसिएटिभ भयो भने चाहिँ जस्ट लाइक अरू प्रोफेसन अथवा अरू एकाडेमिक करिकुलम त्यसरी नै फोकस गर्दै गयो भने चाहिँ जसरी अरूमा चाहिँ यति पर्सेन्टेज यसरी पार्टिसिपेट पार्टिसिपेसन हुने कुराहरू छ त्यसरी नै रिसर्च फिल्डमा चाहिँ जेन्डर ग्याप रिड्युस हुन्छ होला भन्ने कुराहरू आयो बट एट द सेम टाइम हाम्रो एकजना दिदीले चाहिँ जुन आफूले फेस गर्नुभएको कुराहरू भन्नुभयो जस्तो आफूले जस्तो वर्क लाइफ ब्यालेन्स र पर्सनल लाइफ रिजनले गर्दाखेरि चाहिँ अलिकति करियर ग्याप भयो भने चाहिँ आफूसँगै स्टार्ट गरेको मेल चाहिँ हायर पोजिसनमा पुग्ने आफू चाहिँ करियर ग्याप भएर चाहिँ फेरि स्टार्ट गर्नु परेको इस्युहरू कुराहरू भन्दै हुनुहुन्थ्यो त्यसमा चाहिँ उहाँको कन्सेप्ट भनेको चाहिँ जस्तो अर्गनाइजेसनल लेभलबाट अथवा कुनै प्रोजेक्टमा कोही फिमेल हुनुहुन्छ भने जस्तो प्रेग्नेन्सी पछाडिको लिभ जस्तै अरू बेलामा पनि कुनै टाइममा त्यसरी नै फ्लेक्सिबिलिटी भयो भने अथवा कुनै किसिमको त्यसरी नै उसलाई वर्क लाइफ ब्यालेन्स अथवा पर्सनल लाइफले गर्दा उसको कुनै इफिसियन्सी छ राम्रो कन्ट्रिब्युसन गर्न सक्छ भन्ने हुँदाहुँदै भए पनि त्यही लेभलको इन्भाइरोमेन्ट क्रिएट गरिदियो भने चाहिँ त्यसरी करियर ग्यापमा हुन्थेन होला भन्ने कुराहरू भयो अनि अरू भनेको चाहिँ इन्डिभिजुअल सेल्फ एफिकेसीको कुरा जस्तो कन्फिडेन्सको कुराहरू जस्तो अलिकति जस्तो मानव 6 मन्थ 1 इयर ग्याप भयो भने चाहिँ मैले गर्न सक्छु कि सक्दिनँ म त पछाडि नै भएँ अथवा म प्रोग्रेस गर्न सक्दिनँ कि भन्ने खालको कुरा भन्दा पनि अलिकति कन्फिडेन्स डेभलप भयो भने चाहिँ राम्रो हुन्छ भन्ने कुराहरू आइरहेको थियो सो यति नै हो मेरो एन्ड आई विल पास इट टु क्रिस्टिना
Hi. Okay, sorry, I was on mute. So our breakout session, we talked about the importance of talking, let's say, with our question was, imagine that there's an early career researcher named Lakshmi who has challenges related to work-life balance, and she needs to talk with her supervisor. So what are 3 specific ideas for her that we could help her challenges related to work-life balance? And so our breakout room session participants talked about talking with your PI and having a clear understanding of those challenges. Also, if that doesn't work, talking with colleagues and discussing specific solutions. In the situation of, say, you have a partner or close relatives or friends, talking with them or a therapist to come up with specific solutions on how to navigate work-life balance. Also, another colleague mentioned, Yubaraj mentioned prioritization of tasks and thinking about that for Lakshmi. Mentorship is scarce, funding is scarce, and these were some of the things that came up. And there's one thing that I found really interesting was this idea that there's no proper roster of people who are available to talk about work-life balance. So perhaps concretely, having an outlet to talk about work-life balance is needed in a space like this and as an official development opportunity for people. And lastly, if you don't feel comfortable talking with your PI, how would Lakshmi phrase questions? So do you have any suggestions for time management? So if she doesn't want to talk about her personal life, talking with her colleagues in that way. So I'll pass it over to Dristi.
I think you have a last slide to maybe discuss, or is that it, Christina?
Okay. Yes, we have one last slide.
Yes, and can I ask you to keep it to 1 minute because we're running out of time?
Oh yeah, sure. Let's see if I can.
Or Bintaji, can you share that screen?
Oh yeah. So we just wanted to, Benita and I just came up with some responses. Basically that we were thinking that Lakshmi and her supervisor could hold regular check-ins, that there could be these informal talks that are official where you can talk about your values and self-reflection, which will, feed into a better work experience. And then for the second, we were talking about, again, also reflecting on your values and expectations in institutions that would be able to create a safer environment, regardless of gender identities, and fostering flexible work hours and flexibility in how you manage your tasks and prioritize doing your tasks. I'll leave it at that. Yeah. Thank you so much.
All right, thank you so much, Christina and Vinita, for such a wonderful presentation and on such interesting topic. And I thank everyone again for joining us today, despite your busy schedule. And I know work-life balance and everything. So balancing your life and coming to our webinar, etc. And I look forward to next month's presentation. It's going to be super interesting. So I request you all to join us again next month. So with that, we'll end the webinar today. Thank you.
Thank you,
Thank you so
everybody.
much, everyone.
Thank
Thank you so much.
you.